This is Jen and Nikina on eyesurgeontalks. I wanted to discuss sunlight damage to the eyes today. So this is a question we get reasonably commonly. Does sunlight damage your eyes? And the short answer is yes, because it's exactly the same process as sunlight falling on your skin. And we're probably all aware these days of the harm of UV light and the fact that it can cause things like skin cancers and skin pigmentation and premature skin aging. And the eyes are no different. They are also exposed to the same UV radiation, and you can get a number of problems from excessive sunlight exposure. So the simplest most surface thing, I guess, is literally just a sunburn. You can get a type of sunburn where the cornea, the front surface of the eye, reacts to excessive sun exposure, excessive UV, and gets inflamed. This is noticed particularly in mountain environments where you get lots of glare from bright snow, but it can be noted elsewhere as well. The other thing that can happen is the surface skin of the eye, because the eyeball is actually covered by a very thin transparent skin, the same as our body, and it can react in similar ways. So you can get thickenings of the skin, changes in the pigmentation and the color, and overgrowth of the skin, essentially scarring reactions. And we call these pingeculum and pterygium. They're little thickenings of the skin which grow over the surface of the eye and can sometimes even affect the vision. More commonly, they can cause some irritation and redness and sometimes need surgical removal. And the other thing that sunlight can cause is cataracts. And now a cataract is a cloudy lens in the eye. And usually if you develop a cataract that is affecting your vision, then you need an operation to remove it and replace it with a clear plastic lens to focus the light. And cataracts definitely progress faster and grow more in people who've had more sun exposure. Now, this does tend to be a lifelong process, so it's cumulative exposure over your lifetime. The other thing we see with sunlight exposure is an increased risk of developing macular degeneration. Macular degeneration is a problem at the back of the eye in the retina, and that's why you essentially get the retina as gradually stops working well, starts to break down, starts to lose its function, and the vision can be reduced. You can get blurring, you can get distortion, and unfortunately this isn't something that we can fix, this isn't something that we can reverse. So once it begins to happen, it tends to progress, although often it does progress slowly, but currently we have no way of reversing damage. And the final thing that we see that's related to sunlight is eye cancers. You can get similar cancers in the eye to what you get in the skin, so melanomas as well as other types of tumors. These are not common, but they are related to increased sunlight exposure. So, in short, make sure you're protecting your eyes as well as protecting your skin. You need to wear sunglasses with a proper UV block, UVA and UVB block, to protect your eyesight if it's bright outside. With sunglasses, if you are in a bright environment such as mountains or the beach, make sure you've got a thick sidearm on the glasses to protect you from side glare, and also make sure they're rated to at least a category 3, and in some cases perhaps a category 4 for UV protection, in order to afford you the best protection you can against the harmful UV radiation.